Hey, it's Dr. Morris of Magnolia Medical. I'm going to show you a couple things that you need to know if you have knee pain. Okay, so these things are not often looked for. You go to the orthopedic and you have knee pain, and they look for why you have knee pain. All right, so they look to see, do you have a torn meniscus? They look to see, do you have, this is Darian, by the way.
Hello.
All right, Darian's rock star therapist in our office. They look to see, do you have like a tear in a meniscus? They look to see what are the ligaments intact. Look to see you have any osteoarthritis, maybe past Osgood-Schlatter, or some chondromalacia patella, which means arthritis behind the patella, basically. So they look for all those things, but what they fail to generally look for is the reason why you have all that stuff in the first place. So I'm going to use Darian here as a guinea pig, and I'm going to show you a couple things that are often not looked for. Okay, so what happens? One of the first things that happens if somebody has knee pain or they're getting degeneration in their knees is their arches fall. Okay, so they wear poor shoes. They don't have any, they honestly just wearing shoes, because wearing shoes supports the arch and doesn't allow the muscles in your feet to work all the time because they're supported. So even, funny enough, just wearing good arch supports your whole life can contribute to weakness in the muscles inside your feet. All right, so the arches fall. Okay, so turn this way for me. Now, he's got some baggy pants on here, but if his arches fall, if the arch falls here, then his foot's going to roll in. Now, you see, if his foot rolls in there, look what's happening to the knee here, right? So that changes. So what will happen is there's going to be extra stress on the knee joint, but the patella, his kneecap right there, will start to track that way. So the patella will be pulled this way by his quad. He's got a cell phone there, but he's got some massive, massive quads, right? So the patella starts to track laterally. So you get wear and tear behind the patella. You get extra stress from his body weight on the knee joint. Instead of things being supported properly and everything tracking normally, you get the knee where extra weight is on it, on the joint. And instead of having pressure on the inside and the outside equally, you get this or this, all right? So fallen arches is something you need to look for if you have knee pain. The interesting thing is, if you don't address that, how are you going to ever get the kneecap to line up? And how are you ever going to fix the knee if we don't fix the feet, right? So that's one of the things we've got to look for if we have a knee problem. Okay, another thing is in turnaround. Now, none of you ladies get to post any kind of comments here, because we're going to look at Darian's hindquarters, all right? So look at that. This is great. All right. So the other thing is weakness in what's called the glute medius muscle, the gluteus medius. All right. So glute max is his butt, right? So if he sat down, he'd sit on his glute max. But there's another muscle, glute medius, which is high up on the high up here, not down here. And that muscle, if that's weak, it causes all the muscles on the outside of the leg, including the quad and the hip flexor muscles, to function differently, and all those pull differently on the quad. What happens is, if he's weak there, he'll also collapse to the inside, forcing that kneecap to track laterally and putting extra stress on the knee joint. So a couple things, just keep this in mind. You've got to have good arches. All right, you can't have your arches collapsing and expect the knee joint to stay in place, and you can't have a weak glute medius muscle and expect the knee joint to do well. So if somebody has, can I have you lie down here? I'm going to tell you a way to check the glute med. Okay, so I'm going to have you lie down on your stomach. Okay, so you can have to get somebody to help you with this. But one of the ways to check to see if your glute med is, if things are firing the right way, okay? Now we're going to look at glute max here a little bit. Keep the leg straight, touch the butt muscle, and then lift that leg up. And you also want to touch the muscles on the low back on the other side, all right? So keep that leg straight and have him lift the leg up off the table. Now, what's supposed to happen is he's supposed to use these muscles first, not these. You can put it back down. If the muscles in their back, so I'm checking the left leg, I got my hand on his left glute and his right low back. If his right low back muscles contract before his glutes, then he's underutilizing here and he's overutilizing here. Over time, that will create hip problems and knee problems. So you want to make sure that these muscles are working right. You might have to do some exercises to help that. So if you already have knee issues, if you've already been, thanks Darian, appreciate it. And you're going to get some nice, you probably get some hearts. You guys give Darian some hearts there, okay? You ladies, give him some hearts for that, all right? if you already have knee issues, there's lots of things you can do besides having surgery, all right? You can do exercises to help get the muscles functioning right so the kneecap tracks properly. That's one thing you need to do. You can get inserts for your shoes if you've already have fallen arches and you've got to support your legs somehow, your feet some way. You may need to get some arch supports to do that. You can work your glute med. You can do stem cell therapy. If you're young enough and have good healthy stem cells on your own, you can do PRP if you have knee issues. There's lots of other therapies that actually can help promote healing in the tissue. Come with me, I'm going to show you some therapies that we do in our office. This is Whitney.
Hello,
hey Whitney. This is Whitney. She's another great therapist. I'll say hi, Whitney. This is, we call her Cool Whit. Cool Whit, all right? So this is Cool Whit to us. All right, so this, nobody's on here right now, but this is PEMF therapy, which is pulsed electromagnetic field therapy. This uses a pulsing electromagnetic field to help increase how the cells respirate or exercise, if you will, bringing nutrients in and pushing toxins out. Professional athletes use this type of therapy to help them speed up healing. That's how they can get back on the field quicker. We've had patients that have done this where the healing of a broken bone is speeded up significantly by doing this therapy because it actually promotes healing in the tissue. We also have some other therapies, come with me, like microcurrent therapy. This also helps bring extra blood flow to the tissue and helps the nerves function better. So we do this on knee patients. And you want to show them, Daryl's going to come with me and we're going to look at one other therapy that we do, all right? I'm going to walk through the office here. So I'm going to trip over some stuff. All right. All right. So this is the whole thing. You guys haven't seen the whole office before. This whole office, that's Dr. Faulkner.
What's going on?
So this is Danielle, another therapy assistant, doing great. All right, and this is another therapy that can really help somebody that has knee pain. This is decompression. Normally people think a decompression is for the low back, and we do it for the low back, but you can hook this up. I don't know where the...
Is that down there?
So you can hook this up around the ankle, have it pull the knee and distract and open up the knee joint. If we can open up the joint, we can bring more nutrients into the tissue there, promoting healing, take pressure off the joint if somebody has some osteoarthritis. Wouldn't be the right thing to do if somebody has a full tear for an ACL or an MCL, but this is a great therapy, uses computerized force to help distract and open up the knee joint. So if you have knee pain, there are things you can do about it, all right? So stem cells probably at the top of the list, not always in everybody's budget, but man, we see some amazing results with that. But there are lots of other therapies you can do if you have knee issues, but don't forget the arches and that glute med. You've got to pay, and that glute med. All right. All right. So don't forget, you got to work on those two things. You got to pay attention to those. If your orthopedic isn't looking at those things, you're missing part of the equation in helping handle your knee. Folks, I appreciate you watching. We're going to try and give you videos on things you can actually do at home to help. If you need our assistance, let us know. You can always call the office, 615-225-9100. Y'all give me some thumbs up, a little hearts, give me some likes, and let me know if this video was helpful for you. If you go to our YouTube channel and watch my video on castor oil hot packs for arthritis like knee pain. I show you how to do a castor oil hot pack for arthritis and pain in the knee. It's not just for the knee. You can use it in other joints as well, but go watch that video and let me know what you think about that as well. We'll see you next time. Appreciate you watching. It's a great new year. It's January 2nd. We're gonna make 2019 awesome. We appreciate you guys. Bye now.